Hello, this is Dr. Jackie with Searchlight Healthcare Advocates with an episode of Let's Get Real with What's Wrong with Healthcare. This series brings up issues from real client healthcare problems with the purpose of offering information, potential fixes, and to create a dialogue for solutions to the problem. This episode is part 2 of our discussion regarding Medicare. This part is for seniors who are already enrolled in Medicare and to explain to them what they should do during open enrollment time. Medicare is much more complicated than before due to more choices available and the rules for these services. For expertise in this area, we have Dylan Murray with Brightstar Insurance, who specializes in Medicare health plans. Welcome back, Dylan. I'm pleased to have you.
Hi, how are you?
Great.
So my little disclaimer is I am not an employee of the Centers for Medicare and Medicaid Services. I am an independent broker. I'm licensed in the state of California and other states, and I'm certified to sell Medicare products.
So in our last part, you went over parts and plans.
Yes.
I know they're all complicated,
Yeah.
but could you briefly, just a review for someone who perhaps didn't see the last part, just go over what are Medicare parts and plans?
Sure, absolutely. So original Medicare is got Part A for hospitalization and Part B for medical care, seeing doctors. And the Part A is covered at 100%, Part B is covered at 80%. So that means if you have original Medicare and nothing else, and you go see your doctor, and that doctor visit, the out-of-pocket cost, the total cost is $100. Medicare will pay 80%, and you're left with 20%. So whatever that percentage works out for that particular doctor. When you, if you want to purchase an additional insurance product, that's when you start to get into plans. So a prescription drug plan or a Medicare Advantage plan or a Medicare supplement plan. And those different plans help cover the 20% that's not covered plus the cost of drugs. So your parts A and B are original Medicare, and your plans are just like an insurance plan that you buy to help cover the costs that are not covered by original Medicare.
There is a part to Medicare that if you do not sign up for it at the time of being Medicare eligible, can really be quite costly to you.
Right. So Medicare does not cover prescription drug plans. So you really should purchase a prescription drug plan as soon as you are eligible. And in order to be eligible to purchase a prescription drug plan, you have to have either Part A or Part B active. There are also enrollment periods. So if you miss your initial enrollment period for a prescription drug plan, you have to wait until open enrollment every year. So if you don't get it, you will get a penalty for every month that you don't have it for the rest of your life. So if you go, say, 3 months without it when you should have purchased it, the penalty is relatively small. But if you go 10 years without it, you effectively have to pay for those 10 years for the rest of your life.
I had a client that ran into that, and it was amazing to see. I believe it was something like $40 a month for every month that she could not prove that she had a Part D plan.
Correct. So the way it works is, and let's just, if you, and this is one of those areas where there's a lot of regulation. I'm not really allowed to quote anyone a price for what the penalty will be. But if you end up being penalized $40 a month because you haven't had a prescription drug plan, it's not like you pay $40 a month for the same amount of time that you didn't have the plan. You actually pay $40 a month until you die. It doesn't go away. The penalty doesn't, as I understand it right now. It's just, the truth is you can get a prescription drug plan for low dollar amounts. And prescription drug plans are like anything else. If you buy a less expensive one, it's going to have less coverage. If you buy a more expensive one, it should have more coverage. So when you turn 65 or you become eligible for Medicare, just get that prescription drug plan. And there's many different ways to get that prescription drug plan. Sometimes it's through your employer, Advantage plans, separate drug plans, but you want to get that plan in place.
So I have a lot of senior clients, and every time that we come up for open enrollment, I try to encourage my clients to call a broker and review what they have, especially if there's been a major medical event in the prior year or that their needs are changing.
Yes, absolutely.
So tell our listeners why they should have a professional review of their present insurance.
Absolutely. So it's actually the prescription drug plan is a big part of the reason why. There is no one solution that will last you the rest of your life. So when you turn 65 and let's say you choose to have a standalone prescription drug plan, a Part D, and you purchase that, at 65 years old, maybe you're only taking one medication, maybe you're not taking any medications. So over the course of, say, 5 years, you've now added several additional medications. So, okay, for that reason, you should review because, well, let's see what medications this plan covers and at what rates. But really what happens is year over year, the plans will change so that 1 year you might pay, your co-pays for your medications might be a grand total of $100, right? For prescriptions, $25 each, and you have that co-pay monthly. Well, a new plan year, new plans, what you were paying $100 a month for last year, now you're paying $175. The reason why? Because the prescription drug plan changed how it's covering you. So you really need to, even if your medications don't change, the way the prescription drug plans cover those medications will change. So an annual review can be simply just a phone call to a broker who knows the right tools, who in the course of...
Or what questions to ask.
And what questions to ask. In the course of an 8-minute phone call, you could just type in that, the broker knows where to go to check those medications and to see all the different plans that are available and which one will cover those drugs the best. This is not a 2-hour review in the house, right, where you have to schedule a babysitter for the dog or something. Like, this is just a quick 10-minute phone call. But it's really important because you'll see that the prices change.